these wonderful applications that AI could bring. And then, of course, we thought, why not use this at a larger scale? Why not use it in a very different way? And that's where Iksa.ai also happened, where for the longest time, it has always been, non-clinical and clinical divide. And of course, the gap is narrowing today because a lot of people are pursuing unconventional paths. In today's era, it's more tech with little bit of health, because you mostly have product people and engineers building for healthcare solutions without a lot of insight into the industry, into the healthcare ecosystem. It's only a doctor who can tell them what the pain points actually are, and then what and how a doctor will think about it, how a patient will think about it. So those journeys come out only through medical professionals. And if they don't get involved into these things, I think it's always going to be incomplete. And
Hello, hustlers. Welcome to another podcast with Dr. Manthan Mehta, who is MBBS MD in Pharmacology and co-founder and CMO at Iksa.ai. He is a care enthusiast who is working in the newly emerging trendy domain of healthcare, that is AI in healthcare. So, all the enthusiasts who are looking for career opportunities or want to know about the industry of AI in healthcare, this is the right podcast for you. So, welcome Dr. Mehta to our channel Medhustlr. This is a very short introduction about you from my side, but I would also like you to introduce to our audience.
Right. No, thank you, Amay, and thank you, Medhustlr team, for having me here today. And I think it's the best that introductions are kept short, so that we can have, more fun and insightful conversations. But I am, so to say, an unconventional doctor. And I think over time, I've now turned into a docpreneur very recently. And it's been an interesting journey. So I have done my MD in pharmacology. I started my career in medicine in with the pharma industry. And before I joined the pharma industry full time, also I was doing a few side gigs during my residency in terms of consulting for startups, doing medical content creation, and again, doing small projects in medical communication, research, etc. And then I moved full time to the pharma industry, where I joined the medical affairs function, which I was quite passionate about, into the Medico marketing strategy for things. And I spent a good amount of time in my first job, moved more to the strategy role in the cardiovascular portfolio at Novartis. And there I again had the opportunity to work at region levels, a lot of global projects, multiple other initiatives within it, from integrated evidence generation to omni-channel, and actually understanding that the landscape is very, very different. Where I was there, I also had the opportunity to mentor certain startups from Health Tech Africa through a Novartis collaboration. And that, I think, that and the Shark Tank fever put me into the idea that I could probably contribute well to the startups. And then Fitterfly happened, very interesting space in digital therapeutics. I was building personally a heart health vertical there. We introduced the concept of heart age and many great things on how we can improve patient outcomes and impact patients at scale. So my whole idea of doing all of these things is, understanding that we can do things at scale. When you do clinical practice, you have limitations in terms of the number of patients you'll be able to impact. You do a great job in your OPD, in your OT, in the hospital by seeing a couple of patients every day, and over a lifetime you'll see a few hundred, few thousand patients. And but these things and these opportunities into the non-clinical foray, so to say, gives you an opportunity to impact patients at scale. You're looking at thousands, millions of patients at scale, and that again, digital again helps you create that outreach and impact so many patients. And then once I was into the startup world and navigated through those challenges, I thought probably it's time that I venture into something more entrepreneurial, more in a co-founder capacity, and of course with AI as the buzzword, and leveraging all the experiences that I've gained so far, right, in clinical practice, in the pharma industry, in the health tech space, in the startup space, and then thought, let me culminate all of it, see where the problems lie, and let's build Iksa.ai. And that's where we are today.
All right, so thank you so much for the wonderful introduction and walking us through your journey. Physicians are one of the major factors for having the best healthcare system, but they are not the sole that will bring the impact on the larger scale. They are important, but having the best leader, best innovators, best med techs, best health IT, all these contribute to bring getting to a better healthcare system. So next question I want to ask you: how did you get involved for AI in healthcare?
No, interesting. Yeah, so it's a buzzword, right? I mean, everybody talks about AI, talks about things within AI, and people are all looking at it like why AI and what is it going to do and how is it going to impact, right? Luckily for me, I think I was in the digital health space, when this whole AI bandwagon was going on, and we were building something with AI in Fitterfly as well. And that's where, I got some exposure, was in touch with the person and the team that was building it, and got really intrigued that, this is something that can, make things easy for everyone. Like, for example, there two AI things were built. One, we built like an online a nutrition chat support called Jedi. And she was, somebody who worked like a virtual nutritionist, because nutritionists are not available 24/7. And then it was trained on, all the human interactions that had happened, thousands of interactions that had happened within Fitterfly, and it worked wonderfully there. Another initiative was, we realized that time in the app that a lot of people don't, don't want to enter what they are eating. Until they don't enter that, you don't understand how their blood sugar is impacted, and you can't make the necessary changes. And to avoid that friction, there was a camera-based integration that worked. That you just click a picture, and then the AI tells you what it is with all of its nutritional components, and then of course it gets enhanced over time. Similarly, we were working on a AI assisted computer vision kind of thing where it's difficult to understand in the virtual world when you're exercising whether you're doing it in the right way or not. And then integrating that with with the physiotherapy coaches, and so that they you don't really need a person to tell you. Even a person will miss, right, like minor movements depending on the camera, the lighting, etc. And then the vision, computer vision tries to solve that kind of thing. So I was quite intrigued and fascinated by these wonderful applications that AI could bring. And then of course we thought, why not use this at a larger scale? Why not use it in a very different way? And that's where Iksa.ai also happened, where we realized we can use AI to actually understand patient behavior, understand a lot of things, improve their medication adherence, give lot of data that gets generated, which gets missed. For example, if I, as a doctor, and just yesterday, I think I was joking with one of my friends who called me because he was diagnosed pre-diabetic. And he's like, I work out so much, I do so many things. And I went to my doctor here, and you know what he told me? I said, yeah, I exactly know what he told you. He's like, how do you know? So he must have told you that, you go for a walk, don't take stress, don't eat extra sugar. So he said, yeah, that's exactly what he told me. And I said, yeah, that's exactly what doctors tell you. And, you don't, I mean, he's telling a person who, exercises like 1.5 hour every day, hardcore gym rat, to go and walk, I mean, he's like, how am I going to control my blood sugar further? Like, you should reduce some weight. He said, I'm already at like the optimal BMI. So there are a lot of these conversations that don't happen in clinic, and we don't blame doctors, right? You have like a script for every patient very quickly to just go through it. You don't have the time to ask them like, do you go to the gym? What exercises do you do? What is your diet exactly like? To generally refer these things outside. So, and these gets missed. That's where conversational AI can come in, where they can understand what this context is about. For example, imagine doing this podcast using conversational AI, where depending on what question you've asked and what I've answered is where the next thing is going to come up, right? So it's something what would happen naturally, right? Like currently we are talking, and one question is leading to the other, and what I'm talking about is going to help you navigate this podcast into the next step. And similarly, think if AI can just do it, right, and can give even more context and can give you more understanding, can put all that memory in place that, hey, these are things you spoke about, and this is what you can do about it, and these are next steps for it. So I think that's how interesting the space is, and I believe it's revolutionary. At the same time, of course, ethics and guardrails have to be kept in place because it's healthcare. For AI in general, I think everybody is concerned about ethics, but also in healthcare even more particularly. But it's not something that we should shy away from, and I think it's just time will tell us how much AI is going to make inroads into our everyday lives, even including in clinical practice.
All right, sir. Thank you so much for taking your journey from transition to AI. Sir, I know it have been not such a streamlined procedure that when you got into this domain, there have been various hurdles. So, what was your process when you got into such non-clinical careers, or people term it as unconventional path?
I think unconventional is a very nice way of putting it. I think for the longest time, it has always been, non-clinical and clinical divide. And of course, the gap is narrowing today because a lot of people are pursuing unconventional paths. But yeah, I think when the journey was started, it was very, very difficult. In fact, even today, it is very difficult, except that now when you say I'm a doctor and like I've co-founded a startup, the conversation changes a little bit. But before that, when I was in the industry, when I was working for pharma companies, it used to be very, very challenging that, oh my, okay, you're a doctor. So what specialty are you? Oh, what is pharmac? So is that pharmacy? Are you even a doctor then? And, things like that. Like if you're a doctor, why don't you have a clinic? Why would a doctor want to do things like this? And many such questions. And it's not, and I don't blame lay people. And like you said in the beginning, right, like Medhustlr looks at the healthcare ecosystem, and the ecosystem is large, but unfortunately the way people have perceived it is, a doctor in a white coat with a stethoscope on his neck and seeing patients. That's like the only job of doctors or healthcare, and that people believe that's the only way you can impact patients. So I don't blame if people believe that, because I know a lot of medicos also believe that, right? Most doctors also believe that, oh, this is the only path. Like, if you're not doing this, this is not, how can it be gratifying? How can it be fulfilling? How can you justify your medical degree or degrees if you do something unconventional? But like I said, it's about impacting things at scale. And if you don't do it, rather, I believe if there is no doctor at the backstage of these things, you're not going to have a successful event, right? And I mean, patient outcomes, let's look at it like a play. If you're doing a play, a large scale play on theater and in an opera house, you really need, there are stage actors, but there also have to be directors, production managers, a lot of things at the back end to have that as the perfect outcome. So I think the perfect outcome for us that time, if doctors are the stage artists and audience are the patients, where you want to give them the best outcomes, it's not uh, an on-stage job only. It's not those 2 hours that decide everything. There are a lot of things that happen. And with healthcare AI, with all of these things, and every role I think that I've played, be it in the pharma industry, be it in digital therapeutics, and now be it in AI, if you don't have a medical person in it, I always used to say when I used to talk for health tech that in today's era, it's more tech with little bit of health, because you mostly have product people and engineers building for healthcare solutions without a lot of insight into the industry, into the healthcare ecosystem. It's only a doctor who can tell them what the pain points actually are, and then what and how a doctor will think about it, how a patient will think about it. So those journeys come out only through medical professionals. And if they don't get involved into these things, I think it's always going to be incomplete. And it's we who are going to get suboptimal products, suboptimal care in multiple ways. But yeah, there are a lot of challenges. And even for people who get inspired, today to take up entrepreneurial paths or AI paths or unconventional paths, you have to be mentally prepared for these kind of so-called stigmas of non-clinical. They exist, and I think they will continue to exist for a long time.
All right, sir. Thank you so much for taking through your journey for this segment. So the next question I want to ask you, when you were pursuing your MD pharmacology, so did you already had decided that you will go to this unconventional path, or some project or something that came in your way that has shaped to take this decision?
So I think when I took it up, I had of course done my thorough research that what career paths and journeys look like, and to be very honest, I think stalked more than 200 profiles on LinkedIn of people who had done MD Pharmac, and where they were today and what they are doing. So I was when I did that, I was quite certain that I want to get into medical affairs. I want a corporate kind of a lifestyle, and want to be in medical strategy, and really tread that path. A lot of things changed within that journey. So not during MD, but yeah, during MD, I had the opportunity to do a lot of projects which were multifaceted in many, many ways. I had a lot of exposure that helped me understand the industry, understand how I can do better within these decisions that I've taken already. So to name a few, I think I was very lucky to be selected for the Novartis Biocamp back in 2015 through a very lot of competitive rounds, and then top 50 people go to the India rounds, where there's like a 3-day hustle with the workshop and some projects and case studies. And then you have to do some presentation in a team, and then they judge you in different ways. And it was, I think, 3 people were chosen to represent India at the global one in Switzerland, and I was lucky to be one of them. And even luckier that that announcement was that time was made by Sundar Pichai, who was not the CEO of Google that time. He was handling the I project that they were doing with Google. So that I think changed. It helped me see a lot of different perspectives. Going then to Switzerland for that again for 4 days, to then see people from 50, 60 countries who have come through these journeys, understanding what their aspirations are and what the industry looks like, what at a global scale, how things do, and what different healthcare ecosystems work like. So that was, I think, one. The other one was I developed keen interest in pharmacoeconomics when I was doing this. Did have and liked numbers and all those elements, and understanding unconventional things even within pharmacology. So to be very honest, and now I think I can safely say it was not the drug receptors that excited me about it. It was always how you can bring in a lot of variations within it. So there were a lot of subfields globally which were explored, not so much in India at that time. And I got that opportunity to do a pharmacoeconomic study and selected for a student award in the US. And I got a chance to go there and understand healthcare systems, pharma reimbursements, and a lot of things, just broadened my horizon. So in a way, when I stepped into the industry, even in a fresher role, I had an overview of like things and how broad a lot of things are. And honestly, I wasn't so sure if I'll get into an entrepreneurial journey, but I do remember my first interview, and my medical head that time, she told me that I think in the next 5-6 years I will see you doing something entrepreneurial. And I think the words have come true today. But a lot of it today, of course, is by chance, by trial and error. And I think took up opportunities and took up risks that came my way. I had visioned a very conventional career for me, even within medical affairs, because that I'll have a very conventional path. And then, of course, I took a bit of a detour, and I think now I'm on a completely different road. But I'm happy where the road is leading me, and I think that's how I foresee my future again. I think I'll keep going where the road leads me.
All right, sir. I can see from your journey that you went to opting for unconventional path, and after also taking that unconventional path, again the most unconventional path to getting into the startup ecosystem. So this haven't been so easy, but we will deep dive in this later. But the one more question, sir, I want to ask you, like, how is the curriculum of MD Pharmacology, and can you also tell us to our audience that how MD Pharmacology is different from MBA Pharmacology, and what are all the industrial roles that one can get into after doing MD Pharmacology, and how it is different from MBA Pharmacology?